Okay, hopefully video on orders. We're going to go over a couple orders that are a little more difficult to place, and then we're going to do two different admissions on patients to give you an example. One of them is a stroke patient, and here at TMC we have to do stroke bridge orders, which can be complicated. So first let's do some NEBs. NEBs for some reason don't always show up on the RT's end, so we have to make sure we do them right. I have mine saved under a respiratory folder. So what we're looking for is something that looks like duo NEBs. That's if you want to give the albuterol and Atrovent together, obviously. So when you were doing it, let's see what would happen if you search for duo NEBs. So duo NEBs does come up, and you could change it to you don't want the PRN, and the frequency is why it doesn't show up on the RT's end, because normally when we just order it, it'll be a nursing order or something, so you have to actually hit RT, and then I'll do once. So the RT is what makes it go to the respiratory therapist, not the nurse. And then dose, if you want to give 3 back-to-backs, you would change that to 9. So I would search for DuoNeb, change it like this, and save it as a favorite. Let's see what it looks like under the like a respiratory power plan that the hospital might have. So I'm going to go to all power plans, and there's a COPD one. So medications, looks like they have an ipratropium albuterol, which would be the DuoNeb. So I'm going to click that, right click and modify. Just want to see what they have. So everything's pretty much the way we want, except it's 1. So if you want to give them 3, you change it to 9. And that frequency is just once. So it'll work, it's just not going to send it to the RT, and there'll be a delay. So you want to change it to RT once. And that's a pain in the butt to remember, so that's why I recommend first time you do it correctly, save it as a favorite. Then you never have to worry about it again. The other thing that's strange to order is like an ortho boot. So let's search for ortho boots and see if it comes up. No, orthosag vital signs come up. So what I think you search for is orthotics. So orthotics and prosthetics. You've got your X. You can drag this up and let's see what we have. You have your different options right here. So you have I would just do ortho boots and right click, add to favorite, and save it somewhere so you don't have to search, or you don't have to remember for orthotics and prosthetics. So that would be an ortho boot, and then I think knee immobilizers here. I would do a knee immobilizer same way, save it as a favorite. For me, I think I have it under a nursing folder that I made. Things like Foley, wound care, and I've got my orthotics over here. Let's see, the other thing that you might want to remember is splints. Even though we do the splints ourselves or have the nurse do it, you want to put an order in so we get the reimbursement for it, for the supplies. So if you just search splint, you can see the different kinds of splints here, and be sure to save those. So that's NEBs and orthotic supplies and splints. Now let's go over admitting 2 patients with bridge orders. So I've called the hospice on these patients. My notes are ready. I'm going to admit from inside my chart. Remember, if I want to do it from outside my chart, I would just go to this add order section, do my AOT and my bridge orders. But I like to just do it all at once. I can sign my note and it's going to be reflected in my note. So I'm going to go down to impression and plan. You can see I've filled all this out. I'm going to launch disposition order. These are the orders that have been done on this patient. Hit add. First, my decision for admission. Click on it. I'll put her in tele. And I'm just going to back time this a little bit because it's been a few minutes since I talked to them. So I'm not going to hit sign yet because I need to do my bridge orders. That includes my AOT. Bridge orders. So I'll give her a renal diet because she's a renal patient. I'm going to fill out my AOT. Click, right click, modify. Place her in OBS, tele, diagnosis. The hospitalist was Rahimi. There's multiple Rahimis, so I'm going to click this hourglass. Sorry, it's not hourglass, whatever it is. And I know it's this one because it's internal medicine doctor. I'm thinking ahead, I'm going to copy this because I don't want to search it again when I have to verify the ordering doctor. Length of stay less than 2 midnights, and again, suggested placement for the third time. Now I'm going to right click, order physician, verbal with readback, and paste in Rahimi's name. So he'll be seeing her soon. I'm not going to do any of these other meds. I'm going to go ahead and sign. Finish my note. I just need to add something real quick here. Sign my note. And that patient is done. So with stroke patients, this patient I'm admitting for a stroke. Besides putting the reason we didn't do TPA on stroke patients, we also have to admit them under stroke bridge orders. This is something that we agree to do for the hospital. It's to make sure that all the stroke orders are in and compliant for whoever accreditates us for stroke. It's really more of a courtesy on our part, but when we don't do it, we get nasty emails and reminders, so it's best just to do it every time. The first part is the same. Do my normal decision. Tele. I'm going to go back to home, and instead of doing this bridge orders, I'm going to go to my favorites. You'll have this set up in one of your favorites after you start. Favorites, and then again to my favorite plans, because it's a whole plan. It's not just an individual order. Remember, these are all just individual orders that I made. But under favorite plans, or order sets that the hospital has made and that I've saved and modified. So our stroke coordinator will place a bridge order stroke set in your favorite folder when you start. So that's what this is. You just click on that, and you can see the whole big order set that we helped them out with. I usually go ahead and give them an aspirin. First thing I'll fill out is the AOT. Click on it, right click, modify. Some things are already pre-filled. I'm going to paste Rahimi, because I already still have it saved, but again, if I had to search for it, I just put his name in, get the right one, length of stay. Thankfully it already has this filled in for me. And then I'm not going to place Rahimi's name right here just to show you again what it would look like when you forget to do that, which I still forget frequently. consult to provider, right click and modify. I'm going to go ahead and put a neuro consult in. So priority is always routine, unless you've talked to them and want them here in an hour. I am going to put Dr. Satyan as the neurologist. Have I spoke to the physician? No. If I spoke to them, obviously I just click yes, but this is just a consult through the computer. And then you should always put the reason for your consult. If this was a different patient, like a cardiology patient where you're putting in a cardiologist, I might type chest pain, but one of the complaints that people get is they don't put the reason for the consult. On the stroke bridge order set, it's already pre-filled in. Diet. I'm just going to take this out because I don't know what they want. And there's a bunch of other stuff that they have pretty much selected for us. As you can see, all these NIH and assessments, stuff that has nothing to do with the ER, strictly to do with upstairs, but we've agreed to do for them so that there's no fallouts. So this patient should be ready. Orders for signature. You can see everything there is. Hit sign. We're going to have to override these repeat orders because these orders, I guess the bedside swallow was already placed on the stroke orders when they came in. And I didn't put that Rahimi, I didn't verify that, so I'm going to have to go back to this, right click, order physician. And now that's done. Let me correct this. So there's a couple examples of some bridge orders we placed. Now, while we're talking about strokes, just like there was a stroke bridge orders for admissions, there's stroke orders for when we first see the patient. These will also be placed into your favorite folders by the stroke coordinator when you start. So I went into orders, I'm going to go to favorites, my favorite plans, and there's going to be level 1 and level 2 strokes. Level 1 we consider less than 12 hours, level 2 is after 12 hours. So you should do these order sets for any strokes that you have, and it's just things that we don't want to go through and order every time, but things that have to be ordered because they're strokes, like the NIH, swallow studies. Diet is always MPO, but sometimes I'll just unclick that if I know it's not a real stroke. Just like the chest pain order sets we talked about, just make sure it's stuff that you want every time. I generally don't mess with these. I'll just unclick the consult because I'm going to wait to consult somebody. The CT head is already ordered here. The only thing I would do is to keep my radiologist happy, I just hit OK. But I would go down to the actual CT, open it up, and for my reason I'd give them a little details so they don't call and say, where is this patient having symptoms? I'd say left leg weakness. So that's just the example of the stroke initial orders. You want to choose between level 1 and level 2 and unclick the things you don't need and be specific on the reason for the head CT. So let me review my notes, see if there's anything else we want to go over this video. I think that's it. Okay, so let's do now just some general orders just to give you an example of what ordering some things can look like. I'm going to do these just with the order sets that they've provided or my favorites. So let's say I had a basic patient with some vomiting. I don't want to search for everything individually. I'm going to just go to my favorite folders, things that I've set up. You can set yours up however you want. You could go into an abdominal pain one and have everything you need there, but let's just do something out of my favorites. So I could just do CBC, CMP. Remember, these are all labs that I've individually saved over time in a lipase. I'm going to go back to my favorites folder now for the fluids. I have a fluids tab here. I've saved all different fluids over time. And now I want some nausea medicines. You can hit up or just go back to your favorites folder. And I know I have a folder for nausea here with some Zofran. And my orders will be done for that patient. Very easy after you have things saved. Let's say I wanted to do that out of an abdominal order set, and we'll use the hospitals, not mine. This would be like your first time. Be sure to, look to see, go over when you have some time all the different order sets. Oops, clicked the wrong thing. Hold on one second. Okay. So I'm going to go to all power plans and abdominal pain, say female. They're going to have some things pre-selected. I don't care if they're MPO. Morphine, change it to 4. Zofran. Choose the labs I want. CBC, I was already there. CBC. Looks like the chemistry, I want the lipase. And the CMP is under panels. The abdominal pain order set's nice because it has, you can add, it's got troponins you can click, chest x-ray, EKG is all here. Let's do a CAT scan, IV contrast only. I'm going to right click, modify, and put the location exactly. And then orders for signature. I could submit all that, or I could save these labs if I'm starting a lab folder, whatever I want. Now, last example will be combining an order set and some individual orders. So let's say you've got a COPD patient. You normally do a cardiac workup on them. So I'm going to go to my favorite plans, my chest pain order set. I'm going to send all those through. Before I click sign, now I want to add my nebs and my solumedrol. So I've got all these orders ready to go. And then I'm going to hit add, go to favorites, and go to my respiratory folder. I'll go ahead and add some solumedrol, the duonebs. Now those are added to the orders. Let's say, well, actually I want to add a lactic acid too. Go back to favorites, and go to my lab folder. If you don't have lactic acid saved yet, you could search lactic acid level. Change it to stat. And so now I've pretty much got everything that I want on this. Oh wait, I forgot to give fluids. So again, I'm going to hit favorites, and you could go to any of the order sets, pull some fluids, you could search for it. I'm going to go to my fluids folder just because it's the quickest. I get the fluids that I've saved and sign it all. So now we just did a chest pain order set with some COPD labs and kind of combined everything. So that's pretty much it for your orders.